Susan is the Vice President of Population Health for a major healthcare system. She's working hard to improve patient outcomes by streamlining care transitions and getting patients more engaged with their providers. But she's facing some tough challenges. She's used several software packages trying to better stratify and track groups of high-risk patients, but there seems to be a disconnect. She's collecting lots of data and tracking historical trends on the population she's responsible for, but it's not having much impact on her readmission numbers or other important metrics. When she purchased these software solutions, she'd been very optimistic, hoping they would simplify the process of managing patients once they leave the four walls of the hospital. But she's quickly discovered that without any practical, collaborative system redesign or workflow management support from the software vendors, she's right back where she started. One day, while Susan is attending the annual HIMSS conference, she bumps into an old colleague from another healthcare organization, a VP of care management named Kathy. As they get talking, the subject of care transitions comes up, and Susan can't help but vent her frustrations with the situation. Kathy's been through this experience too, and she knows Susan needs a new perspective to get on the right track. Population health software is inherently limited unless it includes a combination of real-time analytics and workflow support for both patient engagement and care manager activities. Susan isn't in love with the idea of yet another vendor. She doesn't want to end up with the same kind of one-size-fits-all solution that her clinical staff will hate or that will create more work for her. The next day, during a breakout session, Kathy catches up with Susan to tell her about her first experience with Locus Health. To test the waters, before getting in too deep, they partnered on a single population, Medicare patients, and a focused challenge, reducing 30-day readmission rates. Kathy had been surprised to find that with the care transition and coordination program that Locus Health helped her to design and implement, she'd seen a more than 40% improvement over historical readmission rates. Susan's impressed by the numbers, but she's convinced that her leadership will want her to develop an internal solution. So, the headaches continue to grow for Susan. Her current setup isn't scalable or replicable across different populations. Incompatibility between software platforms means data's getting lost, if collected at all. As each department develops its own approaches to post-discharge follow-ups, things get even more complicated. With stubbornly high readmission rates persisting, she realizes she needs to make a change. So one day she picks up the phone and finally calls Locus Health. The following year at HIMSS, Kathy spots Susan in the hotel lobby. This time, Susan is grinning ear to ear because over the last few months, she's streamlined and standardized post-acute care transitions for not one, but 5 top priority patient populations with the help of Locus Health. And she'll be onboarding 3 more later this year. And readmission outcomes are improving substantially. Just like Kathy said, Locus Health helped Susan to leverage the staff and IT resources she'd already invested in, providing what she started calling her operating system for population health management. Because it doesn't just provide useful analytics, but helps her coordinate the blue-collar care management side of her operations too, so she can deliver the right care for the right patient at the right time with far more precision and scale than she'd thought possible. If you're like Susan and want lasting improvements in patient outcomes and the cost of care, contact Locus Health today so we can roll up our sleeves and tailor your platform for better population health management.